Hi all, welcome to OET Speaking and Writing. Please read this card. You have 2 minutes for the preparation. Setting is a community health center. So we can start our conversation by saying good morning. My name is Sarah and I am the registered nurse working in this community health center. Please be seated. How may I address you? Then the patient might say her name. Here, let's assume the name is Miss Maria. So, we can ask the patient like, okay. Miss Maria. Tell me. How can I help you today? Probably there. Patient might say you like, Sister, I have ear pain after ear piercing. It's getting worse day by day. Then we need to reassure the patient. So you can tell her like, don't worry. You are at the right place. I will do the needful for you. Before proceeding further, I need to understand. What's exactly going through. I need to ask some questions, can I? Probably patient may allow you to ask questions. So you can ask questions like, could you tell me when did it start? Then you can ask, would you rate your pain on a scale of 0 to 10 where 0 is no pain? 10 is the worst pain you ever had experienced. Then you can ask, did you have any previous episodes of the same? These questions you can ask as per our first task. Then, you can examine the affected area. So you can ask permission, can I examine your affected area? After getting permission from the patient you can tell like, thank you for allowing me to assess. Based on my examination, I can see the presence of a small fluid-filled lump on your ear. But don't worry. It is a common condition. Many people might experience this lump after ear piercing, which is totally manageable. Then, as per the interlocutor's card, patient may ask you question like, Sister, I am really concerned about this problem. Could you tell me more about these? Then we need to reassure by saying, oh, Miss Maria, there is nothing for you to be worried about. I will explain everything in detail. This condition is called granuloma. It is formed of cells to fight against infection. So there is nothing for you to be alarmed about. It is important for you to make sure you do not remove the earring, because it will lead to closure of your hole, which might trap the infection in the skin. So, please do not remove earring in order to avoid the complications. Am I clear to you? Probably patient may tell you like, yes sister. I understood this too. Is it serious? Do I need to take any treatment? Then we can tell the patient like, please don't be panic Miss Maria. It is not severe. It will go by itself. And it's only a slight infection, no signs of any severe infection. I would like to suggest some home treatment. Can I? Then you can tell some suggestion, like Miss Maria. Please make sure that you wash the affected area at least 2 to 3 times every day with warm salt water. Also, please avoid perfume toiletries for the time being, because it may cause irritation. Finally, please press the ear with a watery soft cotton pad against the lump, which will help you to reduce pain. Do you think you will be able to do these measures at home? Probably the patient may agree with you. Sometimes she may ask you the need of antibiotic ointment or over-the-counter medication. Then we can tell her like, I appreciate your concern. If I were you, I would react the same, and I know you are really worried. But I won't recommend you to use any of these ointments at this stage because it might cause complication like severe skin irritation and slow down the healing process. Instead of depending on these type of medicine, you can follow this home treatment which I told you. Are you following me? Then probably the patient may ask you like, Sister, do I need to see a doctor? Then we can tell her like, as of now, you just need to follow these suggestions. You know, Miss Maria, minor infection of ear piercing can be treated successfully at home. But if any of the following symptoms like severe redness, severe infection or any new symptoms arise like temperature, increasing pain and swelling redness formation, in that situation you need to see a doctor. It's really important to seek medical attention immediately. For the time being you can follow my suggestions. I reassure you that if you follow my suggestion, you will get a speedy recovery. It's not a severe infection. After that you can ask like, do you have any other concerns? Probably the patient may ask you like, why did I occur this infection? Then as per our task we can tell like, this is a reasonable question, Miss Maria. There are many possible reasons. One may be because of unhygienic or unsterilized equipment was used to pierce your ear. Or if you are having a sensitive skin or if you are having an allergic reaction, these are the possible reasons of your infection. But it's common. And it will go off itself, within 2-3 days. You don't have to be panic, and in case after going home, if you feel any discomfort, you can just come back, I'll be glad to help you. Okay, thank you, Miss Maria. I hope I have cleared all your concerns. Or you can ask, is there anything else I need to help you? If there is no other concern, tell her like, thank you, Miss Maria, thank you for your patience. I wish you a speedy recovery. In this way, it can end up your role.